Alright guys, so this is day 2. Operation was yesterday, second day. Doing some quad sets with a little assistance from the E-stim. You might be able to see a little contraction there. 15 seconds on and then 30 seconds off. The range of motion that I showed you yesterday is about the same. I tried to do some heel slides on my back today and it was pretty painful, it was pretty brutal. So I kind of went back to that. We might try it tomorrow. I'm at 50 hertz. I have 250 milliseconds on this thing, and then I just have it barely cranked up to the knobs to my tolerance, and just to where it's just starting to hit that tetany, just starting to hit that muscle contraction by itself, and then I try to take over the rest. I'm doing 15 seconds on with a 3-second ramp up time, and then 30 seconds off. I felt like that was a pretty good one there. I saw a couple different things that said 2 seconds on, or 2-second ramp, but that just felt really fast. It just hit it really quick. So that was kind of painful, so I kind of ramped it up to 3 and 4. I've kind of played with it a little bit. 5-second ramp up time was a little bit too long because it was 5 ramp up, 5 contraction, then 5 ramp down. So it felt only like a 5-second contraction. So then I cranked it back down to 3. This thing hurts a little bit. So I read a bunch of articles about how it can hurt in the knee when you're doing those quad sets, especially with the straight leg. And they're right, it doesn't feel amazing. A lot of things out there said you should have your knee bent at 60 degrees and push against something. Maybe that's a little bit later on. But anyhow, day 2 right here coming to you. Thank you.